Well, good morning, everybody, and thank you for being here today. Imagine you're experiencing a mental health crisis, or you're in the hospital and need to be transported to a behavioral health facility. Your options are limited, especially if you have Medicaid. These bills will provide a safer, more affordable solution to people in crisis. The heart of the plan is simple. People deserve timely and professional mental health care, and our emergency departments need relief from the responsibilities that they were never intended to carry. First, this legislation makes behavioral health transportation a Medicaid-covered service. That means helping people get safe transportation to a medical health facility for evaluation or appointment. It helps to make sure that people get the right care at the right time at the right place. Secondly, these bills set clear transportation rules for patient safety. Transportation providers must use secure, medically safe vehicles, and they must also be equipped with important safety features like privacy, GPS, secure seating, and equipment that keeps everyone safe. These standards will protect both the person in crisis and the professionals providing the care. Third, this legislation requires comprehensive staff training. This includes mental health for the first aid, CPR, trauma-informed care, de-escalation techniques, and other patient protections. When we have skilled and supportive transportation staff, it will build trust, which is paramount in an emergency situation. The plan also includes safeguards and oversight. These bills clearly define who qualifies for these services and how providers must operate and what standards must be used to ensure responsible use of taxpayer dollars. And that leads to why Michigan needs this. It's better for patients. A calm and supportive environment reduces attention during difficult moments and helps individuals reach the care they need safely. It's also better for taxpayers. This model makes it so that the healthcare is more affordable while still ensuring high quality service. Think about it like this. The patient that's sitting in the emergency department that needs help, that needs to get from that place but doesn't actually have the transportation available. Or if someone's sitting in a patient room waiting for mental health transport but still taking up our hardworking taxpayer dollars, spend time in the hospital. And it's also better for our communities. Imagine the EMS units that will still be available for complex medical conditions like heart attacks, strokes, and other emergencies. This is a thoughtful, responsible, and bipartisan solution that's helped solve a critical problem for Michiganders in need. These reforms will be a major step forward, a system that helps treat mental health crises with seriousness and compassion and the accountability that they deserve. But most importantly, they'll expand access to the mental health services to make care more affordable and provide real bipartisan solutions for people across our state. Thank you, and now I'll turn it over to my colleague from the House, Steve Frisbie from the 44th House District.
Thank you, Senator Huizenga. I worked 41 years as a paramedic in Battle Creek and had to deal with this situation both as a paramedic and as an administrator. And what became very frustrating as the rise of mental health crisis rose in Michigan and across the nation is the delay in transport. There's a finite number of ambulances available every day, and those are not designed to be driving from Battle Creek to Indianapolis for a patient or north of Saginaw. But that's what was happening. So you'd put a mental health patient in need of a bed far away, and they would spend 4 to 8 hours sometimes in an ambulance that was designed to be protecting the community, as Senator Huizenga said. There's better ways to do things, there's more efficient ways to do things, and there's less expensive ways to do things. And when you come up with a solution that addresses all of them, I think it's a great idea for the residents of the state of Michigan. I'm really happy to support this, and I'm really excited that Representative Amos O'Neill signed on as one of the bill sponsors as well. He's from Saginaw, and we talked about it, and he understood the issues at hand, the timeliness, the safety, and protecting everyone involved, including the patient and the hospitals. So I'm really excited to be part of this and seeing this change and offering a solution that will help pay for an alternative method that's less expensive, more timely, and probably less intrusive to a patient. So with that, we'll have a period of questions in a little bit, but I'm going to turn it over to Senator Sylvia Santana.
Let's see if I can get readers. Yes. Hi, good morning, and thank you everyone for being here today. I stand before you not only as a state senator, but as someone whom this issue is very deeply and personal. Mental health is not just a policy to me, it is family. My father, a proud veteran, struggled with mental health like so many who serve our country. He carried invisible wounds that were not always understood and not always treated the way they should have been. My grandmother also faced mental health challenges at a time when people didn't talk about it, when resources were even more limited, and when too many people suffered in silence. So when we talk about mental health, I am not speaking in the abstract. I am speaking from lived experience. I have seen the impact. I have felt the weight. And also I know what is at stake. That's why today I am so proud to co-sponsor Senate Bill 927 and 928, legislation designed to strengthen mental health care across Michigan and ensure that no one has to go through these struggles alone. Because the truth is, too many people still are. Across the state, families are searching for help and coming up short. Young people are battling anxiety and depression without support. Veterans are navigating life after service without the care they deserve. And communities are trying to respond to crises without resources that they need. And when people cannot access care, those challenges go into something even much bigger. That is not just a system failure, it is a moral failure. Senate Bill 927 and 928 are correcting that. They are about building mental health systems that are accessible, responsible, and accountable. A system that meets people where they are, in their homes, their schools, and their communities. These bills focus on expanding access, improving coordination of care, and ensuring that when someone reaches out for help, the help is actually there. Because timing matters. When someone is in crisis, we cannot tell them to wait. We cannot tell them to navigate a complicated system on their own. And we must also be ready to respond in that moment. This is about prevention, also about dignity, and it's about saving lives. Mental health impacts part of our society, from our classrooms to our workplaces and our public safety systems. So when we invest in mental health, we are investing in stronger families, stronger communities, and a stronger Michigan. But this work requires all of us. It requires partnership between policymakers, providers, educators, and advocates. It requires us to listen to those who have lived experience and to act on what we hear. And today we are taking a step in that direction. To every family that has struggled, to every veteran carrying an unseen burden, and to every young person who feels alone, this work is for you. I carried my father's story with me. I carried my grandmother's story with me. And I know that there are thousands of families across Michigan with the stories just like theirs. They deserve better, and today we are coming to do better. Because Michigan matters, and mental health matters to Michiganders. So I'm glad to support Senate Bill 927 and 928, and we are working to build a future where care is accessible, support is available, and no one is left behind. Thank you, and I'll turn it back over to my colleague, Senator Huizenga.
Thank you, Senator Santana. That was great. I got to say that one of the most important things that we see here is that because Senator Santana and I both serve on the Senate Appropriations Committee for DHHS, and the Senator is the chair, we see firsthand what this means financially for our communities. As a former hospital administrator, I know what it means to have a person languish in a bed, to spend time and dollars and not getting the right care in the right time, place. And Representative Frisbie's experience in ambulance services over the many years that he's had uniquely positions him to be an advocate for this too. On top of that, when we created these bills and this package, we worked with the Hospital Association, we worked with mental health organizations, and we talked to as many stakeholders as we could. This isn't perfect, but it's very close, and we think that this is a chance to really make a difference for the people of the state of Michigan. With that, we'll turn it over and take any time for any questions that anybody has at this time.
Kind of a two-pronged question related to our News Channel 3. First of all, does a person who benefits from this have to be on Medicaid in order to reap the benefits of it? And also, Representative Frisbie, could you just go into how much of, I don't want to call it a burden, but how much time is really taken up for emergency medical services by these calls and having to do these transportation efforts?
The first part of the question about Medicaid, it would authorize Medicaid, MDHHS, to be able to pay for this type of transportation. There is this type of transportation going on already. It's not eligible for reimbursement. So people are doing it for free, hospitals are paying it, and ambulance services sometimes are eating the cost of that. This is a way to support a system that gets the patient where they need to be for that timely, intervention that they need in the mental health world. The second part, can you repeat it?
Yes, just go into, especially for small communities with, maybe limited emergency medical services, how much is this tying up paramedics and ambulances?
Oh, yeah. Well, as I said, we were going as far as Indianapolis, going outside of Gary, Indiana, from Battle Creek, north of Saginaw. That would take up almost the entire shift, 12-hour shift, to go to any of those places, drop the patient off, and drive back. So that ambulance is gone from the community for that entire shift. We didn't design EMS systems to be gone all day out of town. We certainly take emergency patients who need medical care to U of M and other places all across the Midwest, but that's designed in the system. This need, because beds are hard to appropriate from hospitals and when they're available, there's usually a time frame. The receiving mental health facility will say, you need to have them here between here and here, and if you can't, we're going to give it to somebody else. So that timeliness has become an issue. But taking away an ambulance that's designed for emergency medical services within a community is really can have a devastating effect. It elongates response times. There's times in a small community with maybe they have one ambulance or two, and they needed two today, and now there's only one available, so they have to wait from further away for assistance to come. So the Michigan Association of Ambulance Services, who was part of this partnership as well, did a study 2 or 3 years ago, and they took 2 days of mental health transports from point A to point B, and when they got done, it looked like a spider web. And what we had was resources of ambulances crossing every which way to get patients to where they needed to be, but yet that ambulance wasn't available for their community. So it is a big deal. Ambulance services are very much in favor of this because they want to dedicate that ambulance to the role that it was designed to do. But they don't want to abandon the mental health patients either. And they need to have reimbursement opportunities if they're going to provide this level of service. And Senator Huizenga talked about training, and I'm really satisfied. The hospital, when they send a patient out, there's this thing called EMTALA. And the sending hospital is responsible for a patient until they arrive at the receiving facility. It's some weird number of feet. It's like 1,030 feet or something based on a lawsuit, right? So they have to be worried about how well are our patients going to be cared for. Are we going to be trained in HIPAA? Are they going to be trained in that de-escalation? All of those things. And this bill ensures that if you're going to be part of the Medicaid system, you're going to meet all of those requirements. The hospital gets what they deserve in making sure that their patient's well cared for from point A to point B, and the patient gets what they deserve, being well cared for and taken care of safely from point A to point B. So it's a big deal.
I'll just add to that, Remington, that when you think about an ambulance or you see a paramedic service, you also have to remember that The ambulance services are wide and varied across the state. There's public, there's private. In some municipalities, it's the fire department that does that. Those organizations are typically equipped to handle the medical crisis. Mental health is medical, but it's a different category. So you think about that ambulance that's equipped to take care of somebody with a heart attack, that's going to have all the devices and equipment to ensure that they can get that patient stabilized and transported. That's very different than saying we're going to transport someone who has other issues going on. So making sure we have, like I said in my comments, the right person, the right place, the right time all together is really what we're trying to accomplish here.
And with all the questions or conversations, like say, around Medicaid and its changes to the program on the federal level and how we continue to be administered by the state, putting this under the Medicaid umbrella would bring some extent of new cost to the program. Do we know about how much in cost it would mean for the program, and how are you confident to kind of explain that amid larger changes, the state and its Medicaid program would be prepared to do this and take on this cost?
We don't have a fiscal analysis on this yet, but we can tell you that anecdotally, when a patient sits in a hospital bed waiting for them to be transported to a non-acute care facility, that's the most expensive place they could be. And when you look at it statistically, you find that patients can spend extensive amounts of time in a bed in a hospital waiting to go to a mental health facility. This behavioral health thing will change that model completely and will allow it to happen more expediently and put the right service at the right time. The net cost should be lower, and again, it is a federal program, but it's administered by the states, and it's within our purview to provide those services.
And I would add to that an ambulance trip, the bill to go to Indianapolis is probably close to $2,000 or more from Battle Creek. Now they're only going to, in Medicaid, they're only going to get reimbursed about less than 30 cents on a dollar to do that trip. But if we have this alternative option, that's one less person, a less expensive vehicle, but can safely transport them, it'll be at a lesser cost. So my prediction would be we will see fewer cost as a result of this, because an ambulance trip is much, much more expensive than a singular vehicle with a singular person.
Mark Frisbie, Kyle Davidson, Michigan Advance. Just wanted to follow up, make sure that I'm getting my head around this. So namely the reason why we're seeing ambulance get tied up with these things, is this due to the availability of mental health beds? I guess I'm wondering, why we're seeing patients going from Belleville to Indianapolis. Is it a bed availability issue?
Yep.
Is it
Some of it, it's multi-pronged of the issue. It's the growing issue of mental health issues or crisis that needs to be addressed. It's the lack sometimes of beds. It's the which specific type of treatment do they need? So is it a juvenile? Is it an elderly person? So all of those things factor in. And hospitals, when they have a patient in their emergency room, typically are saying they're just shopping. They're picking up the phone and calling everybody who's available, who's available, who's available. They'll take, and they kind of work in the inner circle out, and they'll take the closest bed they can find. So it's multi-pronged, but I think it's solvable in the transportation side, which frees up the bed for the hospital, gives the patient a much more comfortable ride. I don't know if you've ever ridden on an ambulance stretcher for 4 hours, but that's not a fun thing to do. It's uncomfortable. So, and honestly, it's safe. It's more safe in the back of a made safe vehicle than it is in an ambulance. We've had multiple instances across this country where mental health patients have, while the vehicle's driving down a highway, jumped out the back after a small struggle, and they jump out the back. And of course, that's not a good situation. They usually have passed away as a result of that. So this will put them in a situation where we can more safely monitor and keep them where they need to be safely in the back seat.
I'll just add to that our state has continued to invest in mental health beds and resources. Think about in Grand Rapids, the Pine Rest, new pediatric and adolescent facility there, providing the right service for those right patients. And so adding capacity is a big deal. Senator Santana has worked very closely to ensure that we have additional dollars for other acute facilities. And I don't know if you'd like to speak to that, but.
Yes, actually, yes, thank you, Senator. We have taken the step in opening up a new Hawthorne facility here in Northfield. So we will have expansion of bed spaces. That facility is scheduled to open at the end of this year. So that will provide more actual bed space for those who need those mental health supports. But more importantly, we're expanding that for our communities across Michigan.
Recently the House passed Representative Ken Cabot's bill that had to do with transportation of kids to these mental health facilities, making sure that they are not mistreated. Are similar protections put into this bill, or are they going to kind of work in concert? And do you know if there's any movement on Cabot's bill in the Senate?
I'm not familiar with the bill, but everything you described is what we wanted to include in this as well. So ensuring that the patients are going to be in a safe environment, number one. Two, ensuring that there's going to be compliance with the ambulance operators, that they have had all the training, including other medical things, not to the same level of a heart attack type device, but that they're going to still have all the resources to ensure that it's safe, compliant, and mitigating any sort of fraud that'd be associated with those kind of things.
Yeah, the Cabot bill was designed not to address patients from facilities. It was designed to address patients from home. And these are private transportation groups or groups that are coming in and securing a patient. And, you know, we're hearing stories about putting them in hoods and things like that. And I think that will address a different portion of it versus this interfacility issue that we're trying to address with these two bills in both the House and Senate.
Senator Huizenga, I was wondering if you could talk a little bit more about the oversight aspect that you mentioned when we first came up. You know, kind of the idea of making sure that, you know, the funds put towards this are going where they need to go. I mean, what does that look like? Is that something that the hospitals or dispatchers would handle on the back end, or?
It's really mostly about creating the right vehicle to do that transport. So we're going to see a vehicle that's going to be designed to handle the patient that needs that care, versus again the ambulance that's designed for acute crises physically. And so ensuring that those resources are there to make sure that the devices are there, that the transportation is good, and then adding to that the training that goes with the staff to ensure that that everything's going to be handled in an appropriate manner, that they have mental health training to know how to work with those patients during transportation as well.
The only thing I would add to that is that a physician's going to have to approve this level of transport. And these are designed for patients that are voluntarily going for treatment. If you have an involuntary commit, those kind of things, those patients typically are somewhat chemically restrained as well. So they need medical monitoring, and that's the appropriate use of an ambulance in these scenarios of mental health crisis. So it's matching the need and the acuity of the patient with the level of transportation that they could use. And it's physician approved.
Well, seeing no further questions, thank you for coming in today. Appreciate it.
Can I add one little thing? It's not designed just for ambulance services. This bill, the House bill says, you know, if a transportation company can meet these level of criteria to become trained and offer all of those things, they could get in the business of doing that. And the more that's available, I think the better for the patient, for the hospital, and for the EMS systems across the state of Michigan. So there is no restraint of trade that's limiting this to ambulance services. Anybody can get into it. You just have to meet the criteria.
Thanks, everybody.